with breast implants there are a variety of different options that can be considered. The surgical placement of the implant, whether the implant is placed in front, behind the muscle, whether it's placed part in front and part behind the muscle. And there are pros and cons. Some surgeons choose one technique, other surgeons choose another technique, provided they can justify why they're doing that particular technique. I think it's fine. But for instance, if you put the implant behind the muscle, the aim really is to provide extra camouflage for the implant, to reduce implant visibility, with the aim in particular in the upper portion of the implant to give a more natural, more gentle takeoff. The problem with placing the implants behind the muscle is it can be more uncomfortable in the immediate post-operative period, and also when patients contract that muscle there may be a little bit of movement of the implant. So in some patients who have sufficient volume of breast tissue to start off with, sometimes it's better to put the implant in front of the muscle. So that's one potential discussion that needs to take place with the patients. The other discussion is around the type of implants. There are many different types of implants. All implants at the moment have silicone in their outer coating. There are two different fillers, silicone gel and salt water fillers. The majority of UK surgeons and European surgeons, and now American surgeons, use silicone gel as their filler material because they feel and have a more natural consistency compared to the salt water implants. There are within each implant manufacturer a range of implant shapes and sizes. So for instance, you can have what's called an anatomical, which is a teardropped implant, which has advantages if patients don't want to have too much fullness in the upper portion of the breast. There are round implants which will have other benefits, and within the round implants there are different projections. So there may be fuller projection, there may be flatter projection. So there's quite a lot of choice out there for patients. The patients themselves cannot possibly know which implant is going to be best suited for them. And that's where you have to rely upon the surgeon to make an adequate assessment and to be able to work out exactly what the patient needs to best suit their expectations.